Hello, I'm Dr. Jason Rhodes, and I want to welcome you to St. Louis Neurotherapy Institute and our presentation on ADHD and the treatment of children and adults with ADHD. Since 2010, we've worked with over 1,000 adults and children to eliminate or greatly reduce their ADHD symptoms. During this presentation, we're going to discuss what neurofeedback is, who we're able to help, and then we're actually going to go into the treatment rooms and see what a training session looks like as well as the testing. So neurofeedback, with over 30 years of university-based research, has shown a 76% success rate in the treatment of ADHD. In fact, Dr. Frank H. Duffy, professor and pediatric neurologist at Harvard Medical School, was asked about the effectiveness of neurofeedback. This was his response. In my opinion, if any medication demonstrated such a wide spectrum of efficacy, it would be universally accepted and widely used. It's been featured in Time magazine and called the most effective solution for ADHD. And in fact, in 2013, the Academy of Pediatrics gave it its stamp of approval, moving it to Category 1, best supported by research in the treatment of attentional issues. So let's talk about the labels that we give children with various and different learning disabilities and behavioral issues. Labels such as ADHD, dyslexia, autism, Asperger's, OCD, ODD. Well, these labels are identifying the behavior, but they're not telling us what is causing that behavior. So in the sense of ADHD, attention deficit hyperactivity disorder, we're labeling the behavior, but we're not talking about what's actually causing that behavior. That would be like if I had chest pain and I went to the doctor and they diagnosed me with chest pain disorder, but didn't figure out whether I had cardiovascular disease or there was another causal factor. So let's now look at the brain of someone who is having problems with attention and focus concentration. In the brain, we have different lobes of the brain that control various and different behaviors. In the front part of our head, we have what's called the frontal lobes. And the frontal lobes is what gives us our executive control, our ability to be able to attend to tasks, sequence events, and impulse control. And that's the area that children with attentional issues have a problem with. If we move slightly back, we have the parietal lobe. That gives us our sensory, where we are in space and time. In the very back of our head, we have the occipital, which looks at processing visual information. And finally, we have the temporal to the side, and that is what gives us our emotional regulation. So the problem with an ADHD child is a problem with the frontal lobes. In fact, in 1995 was the first time that we had an fMRI study that showed the problem was actually organic in nature. Before that, we just looked at children with attentional issues and said it was a behavioral issue. But since that study done in the early 90s, we saw that there was a thinning of the neocortex, or the outside layer of the brain, in the frontal lobes. Prefrontal cortex, smaller in kids with ADHD. Key functions include impulse control, socialization, reasoning, and judgment. So this affects their behavior because they're not able to function that area of their brain appropriately. That leads to problems with drifting off, making sudden outbursts, and using poor judgment. So the nerve tissue in ADHD, the nerves are smaller and thinner, less connections, and scientists believe that these variations affect a child's ability to attend to tasks and to impulse control. So let's talk about neurological regulation. Neurological regulation is the ability of the brain to be able to move between different arousal states. Now, when we record the EEG, what we're looking at is electroencephalogram. And we get these little squiggly lines that go across the computer screen that we're recording. It's just like if you go to the doctor and you have an EKG done, where they're placing electrodes at various different parts of the heart to record the electrocardiogram, rather, to understand the function of the heart. We do the same thing where we're looking at the electroencephalogram, or the electrical activity of the brain. If you look at this first line, you get what's called the raw EEG. Then you have ones labeled delta, theta, alpha, and beta. And we're going to talk about what each one of these have to do with different arousal states. So these different brain waves have to do with different arousal states. So you have brain waves of delta and theta that are produced when you're asleep and right before you fall asleep. Alpha is kind of right there in the middle, where we set most of the time where our brain idles at. And then finally, beta waves are what's produced when we're externally focused, concentrating and paying attention. The neurofeedback process begins by placing a surface level cap that has 19 different sensors that are going to be recording the electrical activity of the brain. Just like when you go to the doctor and they record the electrical activity of the heart, as in EKG, we're recording the electrical activity of the brain, EEG, or electroencephalogram. Once we record this electrical activity, we can then put that through normative databases that give us maps. These maps then can be used to identify various different signatures such as ADHD, learning disabilities, anxiety, depression, and so on. So based on the QEEG findings, we're then able to understand where the most dysregulated or abnormal areas of brain function are. We then place surface level sensors on that area of the scalp correlated to that most dysfunctional area of the brain. We then develop specific protocols to retrain the brain. As the child's brain moves back towards a more normalized pattern, then they get a reward response. In this instance, it happens to be a movie that becomes brighter and brighter the better that they do. So we have a feedback loop of information being taken from the brain and then fed back to the individual in the sense of that when they do well, the screen gets brighter and brighter. This is a subconscious thing. We're not having to think about this. Our brain is picking up on the activity that's happening from the computer system to the TV. Key diagnostic finding for ADHD is the theta to beta ratio. This is when your brain is producing too much theta activity or that underactivation when you're supposed to be externally focused and concentrating. And if this happens in the frontal lobe, that's especially problems with the impulse control, with sequence of events, all the problems that someone with ADHD has, because that's the part of the brain that deals with executive function. So it's been shown that the theta beta ratio in an adult is 2 to 1, and it's 2.5 to 1 in children. Ratios greater than 3 often suggest ADHD. So in several different studies, it's been demonstrated that 86% of those individuals diagnosed with ADHD using the traditional criteria have a theta ratio greater than 3 to 1. So my question is what about the other 14%? Why do they have the diagnosis of ADHD but yet don't have the EEG signature of the theta to beta ratio? And the reason that is that if you have a child who's anxious, or let's say we have someone whose parents were recently divorced and they're very depressed or they're upset, or even if they have an auditory processing disorder, they will have problems focusing and concentrating in class, but the issue isn't necessarily neurological, or there's something else that's going on. So neurofeedback therapy, it's painless. Very important that the children note that there's no pain associated with neurofeedback whatsoever. It's drugless, it's non-invasive, so there's nothing that's going into the brain. We're just feeding back information to the brain through a feedback loop. And there's been no reported side effects. So over 40 years of clinical use of neurofeedback, there's never been a reported side effect to the FDA. Another example that we can use to understand how neurofeedback works is the use of training wheels when learning how to ride a bike. So very often we can explain to someone how to ride a bike, but they have to actually experience it to learn the activity. So when you're learning to ride a bike, well, you'll often use tools such as training wheels. And so you'll put training wheels onto the bike. What happens is the individual is riding those, they're rocking back and forth. So the feedback is the gravity. As they rock back and forth, we're sending signals to the brain and we're developing new neural connections. And eventually we get good at that and we raise them up just a little bit higher. And again, we get new neural connections, which eventually allows us to take the training wheels off. We've actually learned new neurological activity and the ability associated with being able to ride the bike. So it's been shown that after 30 or 40 training sessions that are about a half hour in length, we begin to develop new neural connections through a process called neuroplasticity. So the brain actually remodels and changes itself. The good news is that once these changes are made, they're permanent. There's been 20-year follow-up studies that have shown permanency of neural feedback. So once the training is done and we've developed new neural connections and new neural tissue, those changes are permanent. I want to thank you for watching our presentation on ADHD and neurofeedback. Please feel free to give our office a call at 314-983-9355 to schedule your free consultation where we'll discuss and learn more about your case and see if neurofeedback is the right solution for you. Again, this has been Dr. Jason Rhodes. I appreciate your time and I look forward to meeting you soon.